Hello, Dr. Kang. Thank you so much for taking out time for talking to me. As we listened to your keynote speech today and we were discussing about vaccines, I'm sure you must have been vaccinated till now. And which vaccine you have vaccinated with, and why?
I was vaccinated with Covishield because Covishield was the vaccine that was available in our hospital. So I think there have been a number of vaccines made in India, and some members of my family have gotten Covaxin and some members have gotten Covishield.
But today you compared all the vaccines, explaining the effect and how long their impact will be. Which one you preferred? I mean, is there anything that you want to suggest to the audience?
Well, in terms of a booster dose, it seems that if you have received an inactivated vaccine, you should probably get a different platform vaccine for the booster dose.
Yes.
That is likely to apply to all vaccines, where getting different platforms might enhance your immune response. What effect it will have in terms of actual protection, we don't have data from India on booster doses, but there is data from Chile, which seems to indicate that 3 doses of a mixed schedule might be better than 3 doses of the same vaccine if that vaccine is inactivated vaccine.
Another thing is that you spoke about children being vaccinated, and you said that whatever vaccines we say, it is vaccine for all and all the children can be vaccinated with these vaccines. But they are not very effective and they don't have long-term effect on children.
The only data that we have on vaccine efficacy and effectiveness really comes from mRNA vaccines being used in children. All of the other platform vaccines, we really don't have data on children. So when we think about, when you don't have real world understanding of how these vaccines are working, should you be getting that data or should you be going ahead and vaccinating children in any case? I think it's important for us to generate the data that shows that there is actually increased benefit to children. Now, when children are, for some reason or the other, immunocompromised or have comorbidities, I definitely think that they should be vaccinated, even without having evidence that they need the vaccine.
But what about nasal vaccine? Do we have data? Because sometimes people prefer to take nasal vaccines. As I have been speaking to people about vaccination and things, they want nasal vaccine. Is it equally effective, and how beneficial it will be?
Well, it would be lovely to have data that showed us that nasal vaccines really work to protect people from disease and infection, and we don't have that data at the moment for either of the nasal vaccines that are available in the world today. And that data, there is a problem. You can't blame the vaccine companies, because for them to get data on real world effectiveness of nasal vaccines is very hard. In principle, nasal vaccines are a wonderful idea.
Okay.
But we know from influenza that the nasal vaccine does not work as well as an injectable vaccine. So will that be the same for SARS-CoV-2 vaccines? Till we gather the data, we don't know.
As per your experience, your decades of study on vaccines, how do you see how India has performed till date, and what expectations you have from yourself and from this vaccine community overall?
I think it's something that India needs to be really proud of, that we managed to make our own vaccines and deliver our vaccines to our population with such high rates of coverage. Now, the next questions that come up is, can we make more new vaccines? I think we should have in India access to every platform technology that exists. We've made the vaccines, but because the vaccines are under emergency use authorization, there's only a very limited number of vaccines that is available in the market for people to buy. So I think the time has come now that all these vaccines that were under emergency use should now be treated like every other vaccine, right? they should be licensed, they should be available for anybody who wants to use them to be able to use them if they want as booster doses.
Question: being a science communicator, when I want to write or talk about vaccines and when I speak to you, we even go into the technical terms, like we talk about spike proteins. Now, while communicating, do you think the common person, the layman, should know about spike protein and the effect of vaccines on spike protein, how they work, how they help you, and things like that? While communicating, what do you suggest us as science communicators?
I think for people to understand the principles on which vaccines work is really important. So the more science we can communicate to people, the better. We are building a scientifically enabled and informed public, and that's important.
Thank you so much for your time.